My name's Clayton Drummond, and I'm doing an audio for an assignment, assessment assignment, interactive assignment, and that's about it. The human mind is a complex web filled with the emotions, the memories, and strategies involved in everyday life. It controls all the essential functions of the body, such as behavior, learning, cognition, and even locomotion. In some cases, the person may not have the right mind to control all the signs above, and they require psychologists to help them revert to normal state. Taking this into consideration, several tools are used in the checking of the behavior of a person. They include the California Psychological Inventory, Caliper Profile, and DISC assessment. This paper is an analysis of the signs portrayed by two patients, Mr. I and Mr. S. The type of test that was used in this case was the Minnesota Multiphasic Personality Inventory. It is a test that is based on psychological knowledge that is used to test if a person is suffering from a mental breakdown. It is administered in two forms, namely MMPI-2, which is mainly based on 567 true or false questions, and MMPI-RF, which has 338 true or false questions. The type that has been used in the paper is MMPI-2RF, which tests the clinical subscales as listed below. The first one is depression, which is characterized by a lack of morale and a hope for the future. It also tests hysteria, masculinity, paranoia, hypochondria, asthenic, can't pronounce that word, I'm sorry, and schizophrenia. Moreover, it tests for hypomania and social introversion. It is a very effective way that is used in making the right ideas about a patient who was shown abnormal observed behavior. Mr. I was taken through the test, and here are the analysis of the results that came up to begin with. He was unable to answer many questions in the following areas: symptom validity, adjustment validity, cynicism, aesthetic, delivery interest. The field seemed too complicated for him, and the results portrayed showed that he had severe weakness in those areas. On the other hand, most of the responses to the other questions were commendable. He answered all the questions given and was cooperative throughout the therapy session. From the results, the man showed some of the signs of cognitive dysfunction, which is the intolerance to frustration and memory loss. Besides, he is likely to show emotional imbalance with the ability to control feelings, which may explain the previous attempts for suicide. He also has some issues with his behavior and has frequent mood changes. His reasoning capacity is also low, based on the ideas he expressed in the test. Mrs. S is another patient who seems to have an anxiety disorder. This is not in the behavior changes that she portrays. She is neat and walks steadily in an unusual way. Her interactions are also standard, and she greets to interacts with everyone in a standard way. She, however, has trouble concentration. She has trouble concentration. This is one of the features that hinders her from acquiring new knowledge. She is easily distracted even by small issues that come up to her. She accepts that she has a problem with handling mathematical problems from an early age. The weakness is only seen in mathematics. After her test in the hospital, she is found to have done well in the tests that involve mathematics, considering that she has a weakness in the area. She, however, fails in the language skills that she had perfected at a young age. It is essential to use the previous information of the patient when considering them for tests. Mental health is an essential aspect of every human being due to the control that it has over behavior and character. One must have the best treatment and diagnosis whenever they show some complications in behavior. Several tests can be used to look for areas in which one is ailing, as explained above. The tests are made in such a way that they contain questions that, when answered, lead to a diagnosis of behavior. They are an essential aspect of psychology. However, it is imperative that therapists maintain and implement daily compassion for the people that they serve. Multitudes of people have suffered from mental health issues, and unfortunately they had the potential to get better, but the therapist, unfortunately was not qualified to work with the patients. You must remember the education to get you certification, but you gotta have qualification. And qualification is the application of your education intertwined with compassion for the people we serve daily. God bless, and I hope you understand what I'm trying to convey here. Thank you.